Well, hello and welcome to Clitoraid's podcast. Today,
Nadine, you're muted.
You
You're
muted.
you're muted. You've muted your mic.
hello and welcome to Clitoraid's podcast. Today, we're going to be speaking about clitoral reconstructive surgery. And to talk about this topic, we have invited two distinguished guests. We have Miss World Somalia, Zainab Jama, whose heart-wrenching testimony about what happened to her when she was a young girl went around the world when she decided to become a global voice against this horrific tradition that happens to many little girls today. And please, Zainab, please know how sorry we are that this happened to you. We hope that we will do anything that we can to help you. We also have Dr. Areeb with us, and Dr. Areeb is a board-certified plastic and reconstructive surgeon, and he has a keen interest in clitoral reconstructive surgery. He is Clitoraid's head surgeon, and he is going to be leading a mission, a humanitarian mission, in March, from March 23rd to March 28th in Kenya. And we are so happy to have you, Dr. Areeb. So, Zainab, you were a victim of FGM, as we said before. And we are not going to ask you to talk about your testimony. We will have a link in below this video to, because we don't want you to have to repeat, what you went through. It's so emotional and difficult. But you're looking for ways to heal from what happened to you. And you're looking into this clitoral reconstructive surgery. So I understand you have prepared a list of questions for Dr. Areeb. And I think these questions will be very interesting also for other patients who are probably asking themselves the same things. So I will leave it. I leave the floor to you, and we look forward to this conversation between the two of you.
Thank you so much, Nadia. Sorry. Thank you so much, Nadine. It sounds the same. I am honored to be here on this, on this podcast with Dr. Areeb and the Clitoraid staff, the team. I am very, very grateful that Dr. Areeb is helping survivors. It gives me hope, and it gives so many hopes to the survivors also who think that they no longer have control over their body. I know that I am thinking of getting the clitoral reconstructive surgery very soon, and for my own knowledge and other people, I do have a few questions. I think this will give so much clarity, not just to me, but to so many other survivors who are also thinking of undergoing this surgery. Some of these questions are about the surgery, and some about the concept of the whole surgery, like the thoughts, the feelings, the emotions, and the aftermath as well. So my first question for Dr. Areeb is that for survivors that are considering reconstruction, what are the key factors they should think about when deciding whether this surgery is the right choice for them?
Thank you so much, Nadine, and thank you so much, Zainab. First of all, I'd like to applaud your bravery to come out. Not everybody can do that. And I'd like the other ladies who are listening to this podcast to take heed and to take courage from you. So thank you so much. So basically, some of the things that you need to consider is, one, you need to ask yourself, do I have sensation? Do I get an orgasm? Am I a lady? Because most of these patients feel like something was taken away from them without their consent. So those are some of the things that you need to consider. It's a surgery that can restore sensation. It can restore your orgasms. It can restore the womanhood, the feel of being a complete woman.
Thank you so much. I'm sure that will give so much clarity to so many other survivors, because I know a lot of people, a lot of young girls as well, that are quite closer to my age, or even some of the older generation. They think to themselves like, what is the point of going for it now? Like, why do I think that this is the right thing for me? I've already lived my life. I've struggled and um throughout the whole whilst they're in their 20s and having kids and stuff, so they probably think that because they're past that age now, what is the point of undergoing this this surgery? But it's like you said, it's still a way of giving them like their life back. So I'm glad that he was able to give them clarity. And for my second question, um is that, are there any specific types or grades of FGM that responds better to reconstruction, or can this procedure help survivors across all grades, like depending whether they have type 1, type 2, type 3? I know it's like type 3 obviously is a lot more severe compared to type 1, but is it still going to be is it still going to give them the same effect?
Yes, thank you for that very valid question. And before I answer that, just to add on to your previous comments, I've had ladies as young as 18 come for the surgery and as old as 60. So, really, the best time is whenever you're ready. And going to the classification, according to WHO, we have four. So we usually take type 1, 2, and 3. From my experience, all the types 1, 2, and 3 have a very good response to surgery in terms of sensation, in terms of orgasm, in terms of just feeling psychologically, a complete woman. So regardless of the type, 1, 2, and 3, we usually operate on all.
Thank you so much. This question is actually a question that I was like thinking about a lot, especially when I was doing my own research on the surgery, and it's all about the appearance. I think one of the main reasons is for survivors to undergo this FGM. Some of them, like when you think about it, even for myself, my own personal perspective, I don't like, I've always felt like I don't feel normal in terms of the appearance, after the damage, because once that damage is done, you don't feel whole again, and the appearance of your vagina is no longer the same. So for me, this question is in terms of physical appearance. How does the vulva typically change after reconstruction? And what should survivors realistically expect regarding the look of their vagina before and after the procedure? Because I know, it's supposed to help you in some sort of way, whether it's to give you, sensation back, or whether it's, giving you the opportunity to be able to go to the toilet and urinate properly without having to feel any pain. But also in terms of the appearance, I know that there's a lot that has been changed and damaged. So, what are the expectations?
So basically, the first thing is that most of these ladies have scars, type 1 and type 2. So the first thing is that we get rid of the scar. And the beautiful thing about this surgery is that depending on how severe the surgery is, you could almost make it scarless. And that is a very important point that we need to consider, because you don't want to replace an FGM with a very horrible scar. So, what do I mean by this? I mean that there are ladies with FGM who have not gotten into a relationship. Once you operate on them, there are techniques that we use that allow you to hide the scars in just on each side of the clitoris. That's number one. Number two, once they get into a relationship after the surgery, the partner may not be able to tell that surgery was done. And that is then up to the patient themselves whether to disclose or not. So as surgeons, especially from a plastic surgery point of view, we are very careful and cautious that we make sure that we make it as scarless and as aesthetically normal as possible.
Thank you so much. A question about in terms of the pain. I know there is going to be um it's like in terms of the, is it the numbing or is it an injection that's used for the surgery?
So basically, when we do the surgery, it's done under spinal anesthesia. That is just half anesthesia. But where patients may not prefer that, or they have any back surgeries that have been done, or any
That's what
issues,
I was thinking about.
yeah. So we can also do full
I was
anesthesia.
Yeah, for me personally, I was thinking about that, and I thought to myself, like, isn't the process of even like going through the anesthesia, isn't that already painful as well? Because I know getting an epidural injection is not when a lot of girls think about it, they're like, wow, no, like the only time they usually think about that is when a woman's giving birth and she's giving that, and we've had a lot of horror stories, so it's like we want this surgery, especially a lot of triggered and traumatized girls. They think to themselves like I don't want to feel like it's the pain. And I know that's something that stops a lot of them is if there is any pain that comes with the surgery, I don't want to undergo through it. Um, so I know there's going to be an anesthesia to, help them, but I think it's the process of even getting that anesthesia done. For me as well, personally, I thought that to myself. I was like, wow, if there is any pain in this surgery, I don't think I'm going to go for it.
Yeah, that is a very valid point. And mentioning pain, most of the patients that I get do mention that there's a lot of pain, and the pain comes because of the scar. So this is before the surgery. So wherever there is a scar, there's usually on and off pain. And once they come for the surgery, we usually prepare them psychologically. And thanks to organizations like Clitoraid, who organize for us psychologists and psychiatrists to talk to these ladies a day or two before the surgery, sometimes even a week prior to the surgery. So already you're already getting over the psychological obstacle. That is the biggest obstacle that the ladies have. And once they're in theater, we usually anesthetize the lower part. And for those who are not comfortable, we can also offer the full anesthesia. But most commonly, we use spinal anesthesia. And after that, there is minimal pain because we usually give proper analgesics.
For the next question, it's about the accessibility for the surgery. So, how accessible is the surgery globally in terms of cost, waiting times, and availability of trained specialists? Because I know where in the UK there is not that many trained specialists that where survivors can go when they're able to get a clitoral reconstruction surgery. Like that kind of opportunity is not available to so many young women across the world, whether it's in Europe or Africa or in Southeast Asia. So I was thinking about the accessibility of women having to have that opportunity.
Yes, so yes, there is an accessibility issue, and there's also a trained specialist issue, which we have worked on. So initially, we had maybe one or two. About this is about 6, 7 years ago. Before that, there was nobody. So we have come a long way, where we have a couple of surgeons who are able to do this in a very methodical way, certified way, and we are working on getting the younger surgeons, the younger plastic surgeons, those in residency. We're trying to create awareness. We're trying to create them to do some thesis on FGM. We are also trying through Clitoraid to organize satellite camps. So for those patients who may not be able to come to the city, we are now talking to Clitoraid and saying, look, we have done a few in the city, and now let's branch out and see. Let's take the surgery and the skills to them.
Thank you. And in terms of the approach, how do you approach trauma-informed care in your practice, especially when working with survivors who may have anxiety around medical environments?
We take that very seriously. We are very cautious. We are very caring. We make sure that we have them talk to a psychologist or a psychiatrist. We also have a sex therapist who is involved. So we try to make sure that every psychological angle is covered because, as I said earlier, the biggest obstacle is the psychological obstacle. And that's where Zainab, somebody like you, with the reach that you have with the younger women, it can really help just to say that, look, just take the first step and the others shall be taken care of.
Yeah, I think we had a conversation about that. I think it's the influence as well. You know, once they see somebody else, somebody that they look up to, you know, a friend, a family member, when they see those women that they look up to actually make, you know, taking that decision to go and get that surgery done, if it influences them in a way like, you know, if I can do it, you can also do it, and then you show them, you know, the positive outcome from the surgery. Like I feel like that helps them take a step forward to actually just, you know, even considering getting the surgery done or thinking about it, whether it's right for them and how it can, you know, have a positive impact on their life. Because I know also there's a lot of trigger and trauma, because it's like, for me, what the way I thought about it was like, you know, I feel like it's the mentally preparing myself that would have taken me a lot longer than going there physically, because I feel like once I lay down there, I feel like all those, you know, those triggers and those traumas, all those memories will come back to me. If although this time around I'm there, you know, and I'm safe, and you know, it's for the right reasons, but everything else returns. So it's like, you know, you just it's a normal human reaction. But I think that's what scares a lot of, you know, young women. So for the next question, for survivors who may feel unsure, ashamed, or afraid to seek help, what message would you want them to hear about taking the step toward reconstruction or simply exploring their options?
So basically, I'd like them to know that first of all, there are certified medical professionals who have worked with ladies before, and the best way I could speak to them is to just share some stories and share some testimonies. We have ladies who have come in who are not able to get married because of lack of confidence. They got married. We have those who are not able to deliver children. They were able to deliver a child through the normal delivery. We have had those who end up getting married but are not able to have sex with the partner. In fact, I've had a very unique story of a couple who got married, and after getting married, the man found out that he just couldn't have sex with the lady. It was completely closed off. And after a week, he helped the lady get over the fears, and they came in and we operated on them. We have those ladies who come and tell me that, doctor, look, I could not apply for this job, but ever since I've done the surgery, I feel confident I can now apply for that job. Others can get into relationships. So there's a lot of positivity, but the biggest positive is that they feel like a woman. They feel like what was taken away from them has been restored.
Yeah, and I think to add to that, it's that womanly essence. I feel essence has been taken from them, and like for them to reclaim it back, I feel like they just need to feel like a woman again and just feel whole. And I think once you kind of like explain to them that we know, like, you know, we understand that you do feel different, you don't, you know, you feel like you don't fit in with other women, but that's because, you know, you feel like you're missing that one thing, which is your womanly essence. And once that's given back to you, like, your whole life changes. You know, it's a very life-changing experience and a life-changing surgery. um and speaking of the surgery, how long does recovery typically take, and what does aftercare look like in the days, weeks, and months following the procedure?
Good question. First of all, the surgery is a day care procedure. It's a day surgery. Patients don't have to spend the night in the hospital. Secondly, it takes about anywhere between 30 minutes to about 90 minutes, and the recovery takes anywhere between 2 to 4 hours. So once that's done, the patient can go home. I like following up the patient on day three just to make sure that everything is going well. There's no abnormal bleeding. There's no abnormal stitch that is bothering the patient. Once that's done, we follow them up at 6 weeks. We expect complete healing of the clitoris. So basically, the clitoris, we actually pull out the clitoris from within the body to restore that the vulva, the aesthetic of the vulva. And once we do that, it takes about 6 weeks for the epithelialization to occur. So once we hit 6 weeks, they're able to engage in sexual activity. It's a very straightforward, very rewarding follow up. After that, in case there's any other follow up that we do, is maybe at 3 months to 6 months. We can also follow up the patients a little bit closer in case there's any complication that arises. But so far, the complications are minor, maybe a little bit of bleeding, which we make sure that we arrest in the theater. For the infection, we make sure that we give adequate antibiotics. And for the retraction of the clitoris, we make sure that we do it in a very unique, methodical way. And majority of the patients experience sensation. Some of them are very, very happy with orgasms. Others are very happy that they're able to see that it looks normal. But generally, whoever has come for the surgery, whether anatomically, psychologically, or emotionally, there is always an improvement.
Speaking on that topic, can you explain, like, and I know there's still, like, a lot of people who don't, quite understand. Can you explain in simple terms what the reconstruction procedure involves and how it aims to restore the anatomy or sensation?
Great. So the clitoris usually looks like a hook, and the those who are trained to cut during FGM usually just cut off the tip. So what we do is we try to advance the other area, and the beautiful thing about how we have been made is that the nerves at the end and the nerves in the body are the same. So about 8,000 to 10,000 nerves. So once we advance that tissue ahead, and then we usually create flaps on the side of skin, and then we turn it in, so that already gives you a fold. Before they come in, it's usually very flat, so it gives them a fold. It gives them that beautiful clitoris that they're able to visualize.
And is there any work done on the, like, the labia and the inner
So,
labia or the outer labia?
so basically, once the beautiful thing about the procedure is that once we're able to create the skin folds on the side, it gives you that feeling of an aesthetic, anatomic look of labias on the side.
Okay. Okay. Um, and this is one of my last questions personally. Um, what kind of outcomes do patients experience, both physically and emotionally after the surgery? I think this is also like a bit of clarity for a lot of people that are still questioning, that still have questions, like me, like other people, always have doubts, always have questions. So we want to know what do your patients experience, like what are the experience, what are the, especially the emotions and their mental state. What is it like after the surgery?
So basically, most of them come and tell me that, doctor, it's a load off my shoulder. It's a burden off my chest. That those are the exact words they use. And some of the patients I still follow up to today, 2 years, 3 years down the line, and they tell me that sometimes I tend to forget that I underwent FGM. So I mean, there's nothing more rewarding than knowing that you're able to get a nightmare out of somebody's mind. Psychologically, they're able to achieve what any normal, female would be able to achieve. And working with females, I've realized they're very, very strong individuals, very strong human beings. And sometimes you just need to do a small surgery and you unlock their potential.
Thank you. For those are my questions. You've answered them all. So thank you so much, and not just for me, but also for, like, all the other women who are listening. And it's just, if it can help one woman, give her clarity and give her, like, some sort of, like, conclusion and summary about the surgery. Like, we're grateful. So thank you.
So basically, what I'd like to also do is thank Clitoraid, because the first obstacle is the psychological obstacle. We're also working on how to get over that. And the second obstacle is a financial obstacle. And through the donations that Clitoraid is so hard, in working to get, it's going down a very good path. It's changing lives. So I'd really like to thank Clitoraid for that. And thank you so much, Zainab, for having the courage and speaking. It's not easy.
I think for especially, I know there's a lot of young women listening, but there's something that I wrote that I do want to share with them. And it's about the whole, reconstruction surgery. So to every FGM survivor, I just want them to know that reconstruction, after doing my own research and, now that I have knowledge, reconstruction is not about fixing you because you were never broken. It's about choice. It's about dignity and reclaiming what was taken without consent. Healing looks different, as Dr. Areeb mentioned, for every woman, and there is no right or wrong timeline. For some, reconstruction, for some, the actual surgery can be a step toward physical comfort, restored sensation, or emotional closure. For others, healing comes through therapy, community, faith, self-acceptance. All paths are valid, and what matters the most is knowing this, that you deserve care, you deserve autonomy over your body, and you deserve to feel whole in your own way. Reconstruction, when chosen freely, can be an act of courage and self-love, not because it erases the past, but because it honors your future. And know that you are not alone, and your story does not end with what was done to you.
Thank you so much, Zainab, for this. Just before the conclusion, you were saying that in England there is not. I don't think there is any surgeons actually that are performing this clitoral reconstructive surgery. So English patients have to go to across the channel to France or to Germany or to Switzerland. But for clitorid, the most important is to provide the surgery where the problem is the most current, which is in sub-Sahara Africa. Somalia, for example, where 95% of the women are circumcised.
98%, yeah.
So
Very.
that's where this needs to be, and of course Kenya and all across sub-Sahara Africa. And the Middle East, so we're happy to concentrate on those areas, and because sexual sensation, sexual pleasure, and I'm saying sexual pleasure is a human right. It's a human right according to the United Nations. So it is not something like frivolous. It's something that is important, especially for women, for all human beings. But for women, it's like Dr. Areeb said, it gives confidence, and for a better world, every person needs to have access to this, and to provide a balanced mind, a balanced mental state. Having sexual pleasure is very important, and so we're happy to help with this at Clitoraid. And if anyone wants to give donation, you're welcome to go to to donations@clitoraid.org. Thank you both for being here today, and we will see you soon, everybody. Maybe for the mission in March. Take care.
Thank you. Bye-bye.
Thank you.
Ok, oui. Louis, on peut arrêter l'interview.